Good morning, guys, and welcome to the podcast. I've got a very special guest for the audience today, Sherri Matheney from St. Petersburg, Florida, and she deals in health insurance field, and she dubs herself as the healthcare hero. She's licensed in 34 states. She's a private plan specialist and speaker and advocate. And I think in this day and age, health insurance is a huge problem for America and American healthcare. And that's why she gets results. And so I'm really happy to have her on. Sherri, welcome.
Hi, thank you. Thanks for having me.
Yeah. Briefly introduce yourself and what you do.
Yeah, I'm born and raised in St. Petersburg, Florida. I have been doing health insurance for 13 years. My primary clients are typically people who are self-employed or maybe higher income earners and showing them different creative ways to save money. Yeah.
Oh, interesting. And the other question is what in for people listening and especially doctors, they have nothing positive to say about health insurance. What do people come to you for? Is it doctors? Is it patients? And what are they fed up with, frustrated with? What are they trying to achieve when they work with you?
Well, that's a loaded question. So I work with a lot of doctors. A lot of times I'll find out who they accept for health insurance, and then I help their patients get insurance so their patients can continue to see them. Because if they're not in network, they're not going to have those patients anymore. Sometimes I'll help on the back end if it has to do with claims or how a doctor's coding something. So sometimes I'll call the doctors and ask a lot of questions, or I'll call the insurance company and see why something isn't working. Somebody's not talking to somebody, and usually it's an easy fix. But I have to call the doctors, I'm calling a bunch of people to find out
Yeah.
the problem, and
Yeah.
so I try to be a problem solver.
Yeah. One thing is talking about private plans versus the marketplace.
Mhm.
A lot of people they don't know that there's other options
Mhm.
besides employed sponsored health insurance. Talk about the truth that you haven't heard.
Yeah, so a lot of people don't know private plans exist. Private plans are more widely accepted at doctors' offices. From what I gather, a lot of doctors' offices don't like taking marketplace, or Obamacare is what it's known as. So, private insurance is you're going to have better networks, more doctors take it, but there's a lot more flexibility there. If you're out of network, you can still get things covered, right? Get benefits covered and things like that. And it's just a way larger network too. And what's cool is like a lot of people see holistic doctors today. And a lot of doctors don't take insurance. So with the private plans, you can actually get people, if they're not in network, reimbursed for whatever services they do. You cannot do that in the public side of insurance. So the private's really neat in that aspect. And it's a lot more affordable for the people who have maybe a higher income and they just don't know that they exist.
Interesting. The other question I have for you is talk about just obviously the biggest problem with health insurance is the cost. And again, most of everything here, it's so expensive and you get very little. So how do you stop overpaying for health insurance and still protect your people?
That depends on the person I'm talking to, right? It depends on their income, their household size. A lot of times, if people say they do have employer sponsored health coverage and they're paying a lot, really the person who's employed is paying very little. What you're paying for is your family. So a lot of times I'll split the family off and I'll put them on private. Or if maybe you're a new doctor or a new business owner, new anything, a lot of times your taxable income's low and you could probably qualify for free plans. Where the private plans come in is where work insurance is expensive, marketplace is expensive, and if you're relatively healthy, it's just another option for you. But sometimes I'll separate families because it'll save them $500 a month to do that, right? So it really depends on the person I'm talking to. And I tend to ask a lot of questions at the beginnings just so I can make sure I'm putting you in the right spot.
Interesting. You mentioned earlier for the audience that a lot of doctors are starting to not take insurance anymore. And one common fear is that if they don't take insurance, they're going to lose their patient load. So, how do you allay doctors who are saying, we don't take insurance anymore, or even going into a concierge medicine type of model?
The concierge is just for your common colds, right? It's for your like basic simple stuff, but it's not going to help anyone if something like really happens to you. The cool part, like I said earlier about the private plans, is if they don't take insurance, but the patient still sees them, I can send patients to that doctor and just tell them to give me a super bill, which most doctors know what that is. It has codes on it. And I can get them reimbursed from the private plans for whatever it is that they do, depending on what it is and if it's a covered thing. Does that make
Um, yeah. The other question I have for you is just talking about how can people get more knowledgeable about health plan costs, saving them thousands? Because you talk about what a lot of people don't know about your health plan can cost them thousands.
They could reach out to me. I'm licensed in 34 states, so I help people all over the country. Having a good agent, whether it's me or somebody elsewhere, just making sure that they know the business, know different plans out there, and are just trying to recommend a plan before actually having a conversation with somebody to make sure that it works. My favorite thing to say is insurance sucks, right? You just got to pick the insurance that sucks the least for you.
Yeah. Yeah. Interesting. So what in terms of small business owners, what's the biggest mistake that they make when it comes to offering health insurance and plans, and what should they be doing instead?
That's a great question. So I help a lot of business owners. And if you're new or you're smaller, a lot of times I'll do it as like an individual basis, but as a group. They can still pay for it the same way through their payroll. They can either pay for it through their payroll or via a stipend that they pay to their employees. But if they do it individually, it's much cheaper because if you do traditional group and you're just a smaller business, it's $600 to $800 per employee. But
Mm.
if your employee demographic is say 25 to 40, right? You can cut that in half, maybe a little bit more by doing it individually. You should grow your insurance as you grow. So as you're a newer business or smaller employees, it's great to do it that way. And then as you grow, more traditional group might be the answer. So I always offer it as an individual basis and however the employer wants to set that up. And it's just much cheaper for them.
Oh, interesting.
Yeah.
Which brings us to a lot of frequently asked questions around private health. And we talked about how health insurance is different from
Mhm.
marketplace and who should consider private health insurance.
If you're relatively healthy, you're paying to your income's high. Private plans do not cover drug and alcohol rehab, mental health, or maternity. So if you need those things, they're probably not going to be for you. Anyone else pretty much can get a private plan as long as they qualify.
Next question, is there any enrollment periods for private health insurance, or can you get it anytime?
You can get private anytime you want.
Yeah, interesting.
Mhm.
And the other question is, you talked about what private health insurance typically covers. Can they keep their doctor with private health insurance?
Sure. I would always check to make sure they're in network. And if not, I will tell them how the out of network benefits would work for them. Yes. Mhm.
Interesting. Okay. So moving on to small business health insurance, the other question is, who should consider this type of health insurance?
If you're a small business just
Yeah.
starting out, I typically will help if you have 30 or less employees is a good number. I'll help you. I just helped a family actually in Texas and they saved or a small business, excuse me, and they saved about 6 grand a month by switching to individual, just to give you an example. So anyone that thinks they're paying too much, and listen, I'm one of those people. If what you have is great, I'm going to tell you to keep it, right? But if I can help you, I'll suggest, hey, let's move them to private and do it individually.
Interesting. And how does small business differ from self-employed?
Small business is typically you have employees, right? Things like that, or contractors. Whereas a self employed, you're just yourself. You're
Um,
by yourself.
Yeah.
Or they have the same problems.
Yeah. And is there an open enrollment period for self-employed individuals, or is it you can enroll year round?
You can enroll, it depends on what insurance you're getting, right? Private, if they go the private option, there's no enrollment period. If they want to go maybe a marketplace option, then they have to wait until November.
Interesting. And how do you deal with the fact that a lot of self-employed individuals, their income changes throughout the year?
That's a great question. Actually, I tell people, listen, if I put an income in here, because you're guessing, right? It is very important that you keep in touch with me and you say, hey, share, my income's going to go up. $20,000. And if I update that in Marketplace in real time, it's going to be a lesser hit for you at the end of the year. Now, if you don't say anything, you're probably going to owe the IRS. Now, with private plans, they don't ask income at all. That's not even a factor. They only ask how healthy you are.
Interesting.
Mhm.
We, switching the topic to family, because sometimes the breadwinner, they're healthy, and what about you have children and or your spouse, pregnancy, maternity? What if their family has different healthcare needs? How do you address those?
So that's when I separate them, right? You could pay $2,000 a month and all be together, or you can pay $1,500 if I separate you. What would you like to do? And $500 a month to me is a lot, right?
Yeah. And then talk about ACA compliance in private family insurance.
Private plans are accepted by the ACA, but they don't have to follow the same rules. So they don't have to cover, like I said, the mental health, drug and alcohol, rehab, or maternity, and they don't have to accept you. They can deny you if they want to. Whereas Marketplace, they have to cover essential health benefits, your annual physical 100%, drug and alcohol, rehab, and they can't turn you away.
Yeah. So I know we have a few more minutes remaining, and talk about what I found really interesting was reading your profile. You said, why health insurance is like ordering at a bar. What do you mean by that?
You can pick and choose different things to put in it, right? Like you can, like if I wanted a Long Island, it's going to have all the different stuff in it, right? So with private, it's really cool because I can bundle it with dental, vision, life, whatever you want. You can make the cocktail of your choice, really. Whereas if you go Marketplace side, which is what you get, that's what you're getting, and that's it. If you want something separate, you're adding it from a different company, basically.
Yeah. Excellent. How can people contact you and check out your work and connect with you?
Yeah, my website is health insurance with Sherri is spelled SHERRI.com. My phone number is area code 417-763-0295. You can call or text me. And if you go to my website, my phone number is there, my email's there. It's very easy to get a hold of me, or you can talk to me while you're on my website if you want to.
Excellent. Thanks so much for this interesting
Yeah.
conversation, and keep up the great work.
Thank you so much for having me. I appreciate it.